We're back with ADA TV, and we're speaking here with Dr. Neda Rasouli. She is a professor of medicine at the University of Colorado. Thank you for joining us.
Thank you for having me here.
And I hope you've been enjoying ADA so far.
Sure, it's an exciting meeting. It's always my favorite meeting of the year.
And so today we're just talking a little bit about, some of the newer things that have been discussed here at the meeting with cardiovascular disease and chronic kidney disease. Give us an update on what some of the latest talk is.
Sure. We all know as diabetologists, cardiovascular disease and chronic kidney disease are major comorbidities of diabetes, and about 30% of, at least 30% of patients with type 2 diabetes develop these complications of diabetes. So how we optimally treat them, it's very important. And what has happened more recently is more individualized care for patients with diabetes or people with diabetes. And what it translates to clinical practice are there are certain glucose lowering medication that they have cardioprotective or renal protective effect. So the trials that showed specifically SGLT2 inhibitor like empagliflozin or dapagliflozin can protect people from cardiac event or renal progression was kind of released a few months ago. But also we have a new class of medication, non-steroidal mineralocorticoid receptor antagonists, specifically finerenone, that can also prevent progression of kidney disease or hospitalization for heart failure and cardiovascular mortality. So now we have different tools to use in patients with diabetes and heart failure or chronic kidney disease.
And that's been a theme in a lot of our conversations about more individualized care and really speaking to each patient's needs.
Exactly. So, the future is precision medicine. The future is targeting individualized treatment for patients. And not everybody with diabetes has this complication, but at least now we know people with diabetes who have heart failure or diabetes kidney disease, they benefit from certain glucose lowering medications. So personalizing treatment, that's our goal and should happen. But we need, as I gave a talk on Friday at ADA, we need all hands on deck. We all need to work together in a multidisciplinary manner to optimize diabetes care.
And so we talked about these new medications. What would be some of the other guidelines in really mitigating the cardiovascular disease?
What has happened in the past couple of years, now we have given priority to this certain glucose lowering medication that they have cardiorenal protection effect at the same time. So if a patient has diabetes and heart failure, or diabetes and chronic kidney disease, now the first line of therapy is one of this medication, independent of glycemic controls.
So really looking at the whole person and trying to attack from different angles.
Exactly.
And so we also have been hearing about tirzepatides and semaglutides and how they're having an effect on the fight against obesity.
Sure, these are the medications. Semaglutide is a GLP-1 receptor agonist that was shown through SURPASS program and a STEP program. It has, the efficacy on glucose lowering and weight loss is great. But we were super excited about tirzepatide, where SURMOUNT trial, it was presented in the room with a lot of excitement, showed in average tirzepatide weight loss in people without diabetes, just as a treatment of obesity, was about 23%, 22%. There is a shift right now that maybe treatment of obesity should be priority over treatment of glucose, or rather than looking at management of diabetes on a glucose-centric approach, we need to focus on more what is the problem, and that is obesity.
And I'm sure that discussion is going to continue on. Well, thank you so much, Dr. Rasouli, for joining us.
Yeah, it was my pleasure.
Have a great day, and we'll have more for you through the day from ADA TV.